guys, welcome to another episode of Plant-Based Mafia. In today's episode, we are going to be reading Chapter 5 from Dr. Esselstyn's famous book, Prevent and Reverse Heart Disease. You will find on my page that we've already read chapters 1, 2, 3, and 4. And this week, we're going to be reading chapters 5, 6, and 7. So I'm going to post chapters 5 on Monday, chapter 6 on Wednesday, and chapter 7 on Friday. This is one of the most important books ever written in relation to heart disease, preventing and reverse it. So if you do have heart disease and you are looking for a natural way to prevent any further complications or looking to reverse it, go out and buy this book. Just because I'm reading it, that's fantastic. This book should be on your bookshelf. This should be your cardiovascular Bible. And if you are someone that does not have cardiovascular issues yet, but you are eating the typical American diet, it is coming your way like a slow-moving train. And this book will prevent how hard that train hits, if ever. So we're going to jump right into chapter 5. It's called Moderation Kills. It's a fantastic chapter, which will probably scare the shit out of a lot of people. So here we go. Chapter 5. A number of years ago, when I was beginning my research project in coronary artery disease, a prominent local physician who disagreed with me announced that he believed in dietary moderation for his heart patients. Translation, I don't care if my heart patients eat some fat. That's a fairly common sentiment among my medical colleagues. But what are the facts? In science, a review of many studies on the same subject is referred to as a meta-analysis. Such a review of studies on coronary artery disease was done in 1988, when researchers in Wisconsin analyzed 10 clinical trials involving 4,347 patients. Half of the patients had received cardiac rehabilitation, which generally consists of advice to lose weight, exercise, control high blood pressure, control diabetes, stop eating, and eat less fat. The results: the rehabilitated group had slightly fewer fatal heart attacks than those who did not get the same advice. But the researchers found no significant difference between the two groups in the number of non-fatal heart attacks. In fact, the rehabilitated group suffered slightly more non-fatal attacks than those who made no lifestyle changes. The reason is fairly simple. Those who moderately reduced their consumption of fat did manage to slow the rate of progression of their disease, but they did not completely arrest it, and it progressed even as its new, slower rate, it continued to take its toll. In early 2006, a report published in the Journal of the American Medical Association resulted in national headlines suggesting that low-fat diets do not decrease health risks. The JAMA article was based on a study, part of the Women's Health Initiative of the National Institute of Health, which followed nearly 49,000 women over 8 years. And it found that those prescribed a low-fat diet turned out to have the same rate of heart attacks, strokes, and cancers of the breast and colon as those who ate whatever they wanted. Also buried in the news reports about this latest, largest, most expensive study ever was this incredibly important fact. The women who were supposedly consuming a low-fat diet were actually getting 29% of their daily calories from fat. For those on the front lines of nutritional research, that is not low fat at all. It is 3 times the level, around 10% of daily caloric intake, that researchers like me recommend through plant-based nutrition. The Women's Health Initiative study and the conclusions drawn from it bring to mind an analogy. Suppose researchers were studying the following question: does reducing vehicular speed save lives? They find that when a car strikes a wall at 90 miles an hour, all the occupants perish. The same result occurs when the car hits the wall at 80 miles per hour and 70 miles per hour. Conclusion: reducing speed doesn't save lives. Meanwhile, everyone ignores a small study showing that that a crash at 10 miles per hour, everyone survives. The Women's Health Initiative researchers were quoted as saying that their results do not justify recommending low-fat diets to the public to reduce their heart disease and cancer risk. True, they certainly do not justify recommending diets containing 29% fat, the level currently endorsed in the U.S. dietary guidelines. But those of us who have been studying the matter already knew that. The Women's Health Initiative study simply confirms that the guidelines are wrong. We should be recommending diets far lower in fat than those featured in this research. Over the years, the meta-analysis, such as the one conducted by the Wisconsin researchers, have consistently shown that coronary patients who reduce their fat intake do somewhat better than those who do not. But almost always, the best outcome is a slowing of the rate of the progression of disease in patients who receive treatment, not putting an absolute stop to it. These results are not good enough. We should be aiming much higher at arresting coronary artery disease altogether, even reversing its course. And the key to doing this, as my research demonstrates, is not simply reducing the amount of fat and cholesterol you ingest, but by eliminating cholesterol and any fat beyond the natural, healthy amounts found in plants from your diet. The key is plant-based nutrition. Let's review what we know about the science. Heart disease, as I have already stressed, develops in susceptible persons when blood cholesterol levels rise higher than 150 milligrams. The converse is also true. A person who maintains blood cholesterol under 150 milligrams for a lifetime does not develop the disease, whether they are obese or they suffer from hypertension or they smoke. One case in point, the Papua Highlanders of New Guinea. These people are traditionally heavy smokers. Even non-smokers among them breathe in lethal doses of secondhand smoke in communal hutches. Not surprisingly, the Highlanders suffer many lung disorders, obviously, thanks to the smoking. But studies of those who live into their 60s and beyond have shown that despite the well-documented risk of the heart health that is posed by smoking, they have no coronary artery disease. They are protected by their diet, which consists almost entirely of 19 separate varieties of sweet potatoes. Nutrition impinges on cardiovascular health in several critical ways. The most obvious, of course, is that a diet high in fat and cholesterol causes blood lipid levels to rise, thus setting off the process of plaque formation. But isn't dietary moderation enough to stop the process? If you cut back considerably on fat and cholesterol, shouldn't you be all right, as my colleagues suggested? Surely just a little bit wouldn't hurt. Wrong. That's what you must remember every time you are confronted with that tempting tidbit topped with melted cheddar and bacon bits. Moderation kills. And to understand why, you have to understand something about metabolism and biochemistry. Every segment of your body is comprised of cells, and every individual cell is protected by an outer coat. This cell membrane is extremely delicate, just 1/100,000th of a millimeter thick, yet is absolutely essential to the integrity and health function of the cell, and it is extremely vulnerable to injury. Every mouthful of oil and animal product, including dairy foods, initiates an assault on these membranes and therefore on the cells they protect. These foods produce a cascade of free radicals in our bodies, especially harmful chemical substances that induce metabolic injuries from which there is only partial recovery. Year after year, the effects accumulate, and eventually, cumulative cell injury is great enough to become obvious to express itself as what physicians define as disease. Plants and grains do not induce the deadly cascade of free radicals. Even better, in fact, they carry an antidote. Unlike oils and animal products, they contain antioxidants which help neutralize the free radicals, and also recent research suggests may provide considerable protection against cancers. Among the body parts we injure every time we eat a typical American meal is the endothelium itself, the lining of the blood vessels and the heart, and the remarkable role it plays in maintaining healthy blood flow. This is important to really take in. This is really vital. The endothelial cells make nitric oxide, which is critical to preserving the tone and the health of the blood vessels. So think of an old rubber band. We've all seen them. You stretch them out, they're eroded, and they crack. That's what's happening to the lining of our blood vessels and our artery walls when we eat the typical American diet. Nitric oxide is the vasodilator. That is, it causes the vessels to dilate and or enlarge. When there is an abundance of nitric oxide in the bloodstream, it keeps blood flowing as if the vessel's surfaces were coated with the most slippery Teflon, eliminating the stickiness of the vessels and the blood cells that is caused by the high lipid levels that in turn leads to plaque formation. There is mounting evidence of the critical importance of the endothelium. German researchers recently studied more than 500 patients diagnosed with coronary artery disease. They performed angiograms on the patients and also drew blood, quantifying the number of endothelial progenitor cells, the cells that restore or replace endothelium in the bloodstream of each subject. Over the following 12 months, the researchers found that the patients with the fewest endothelial progenitor cells fared most poorly, but those with the most cells did the best. Dr. Robert Vogel of the University of Maryland School of Medicine in Baltimore had conducted some astonishing studies that demonstrate, among other things, what a toxic effect a single meal can have on the endothelium. Dr. Vogel used ultrasound to measure the diameter of the brachial arteries of a group of students. Then he inflated blood pressure cuffs on the students' arms, stopping blood flow to the forearms for 5 minutes. After deflating the cuffs, he used the ultrasound to see how fast the arteries sprang back to normal condition. One group of students then ate a fast food breakfast that contained 900 calories and 50 grams of fat. A second group ate 900 calorie breakfast containing no fat at all. After they ate, Dr. Vogel again constricted their brachial arteries for 5 minutes and watched to see the result. It was dramatic. Among those who consumed no fat, there was simply no problem. Their arteries bounced back normal, just as they had in the breakfast test, the pre-breakfast test. But the arteries of those who had eaten the fat-laden fast food took far longer to respond. Why? The answer lies in the effect of fat on the endothelium's ability to produce nitric oxide. Dr. Vogel closely monitored endothelium function of subjects and found that 2 hours after eating a fatty meal, there was no significant drop. It took nearly 6 hours, in fact, for endothelial function to get back to normal. 6 hours. If a single meal can have such an impact on vascular health, imagine the damage done by 3 meals a day, 7 days a week, 365 days a year for decades. But isn't it enough to simply reduce your cholesterol levels? Why isn't upon a radical change in diet if there are other ways? Why insist upon a radical change in diet if there are other ways to reach the cholesterol goals? Recently, the New England Journal of Medicine reported on a study in which massive doses of cholesterol-lowering drugs were used to reduce total cholesterol well below 150 milligrams. 3 out of 4 of the heart patients involved seemed to do very well under this regimen, but it was not a complete success. Even with their cholesterol levels satisfactorily reduced, 1 out of every 4 of the patients in the study sustained a new cardiovascular event or died within 2.5 years of starting this treatment. I was struck by the fact that there were so many problems, even though both total cholesterol and LDL levels in those patients were reduced well into the range I suggest and often below that. So I called the study's author and discovered an extremely important variable. There had been no nutritional component to the study. When I asked what study participants had been eating, he replied, it was a drug trial. that it continued to eat the same way they had ate before the study began. That explains why so many patients failed. Remember how I asked my patients to compare their disease to a house fire that had been spraying with gasoline, and how I insist that in order to put it out, they must stop spraying it with fuel. That was the problem here. Despite profound cholesterol reduction with medicine, the arterial plaque inflammation, the fire, and the disease progression were inevitable because the patients were still ingesting the toxic American diet, which is the gasoline. The patients in that study who died, whose disease progressed, were subsequently tested for highly sensitive C-reactive protein, or HSCRP. Now, I want to just stop here for a second and talk a little bit about that. I am very aggressive with my doctors, especially on that particular test, and that is one of the things that I focus on. So, of course, I eat a plant-based diet, and I also am very aggressive on making sure that that C-reactive protein, my inflammation levels are very, very low. And I do that not only by eating my plant-based diet, but I also do that by drinking a lot of water every day that has lots of lemon and turmeric in it. Two things that are very, very good in reducing full body inflammation. And I also add things like pineapple and green tea, but I also make my green tea decaffeinated. So keeping your inflammation levels low is very important. And when you go to your doctor, demand what your C-reactive protein level is, because it's all connected. Okay, so the C-reactive protein test measures the level of a specific blood protein that increases with inflammation of the coronary arteries, and it is considered by many cardiologists to be even better than a standard cholesterol measurement at assessing your risk of heart attacks. All those patients who failed turned out to have elevated HSCRP levels. There is a critical clue here to the overwhelming importance of nutrition. In my experience, fully compliant patients achieve normal levels of HSCRP within 3 to 4 weeks of adopting my plant-based nutritional program. The results are prompt, safe, and enduring. 20 years ago, when I started my research, our major focus was on reducing total blood cholesterol levels to below 150 milligrams and cutting LDL to below 80. But today it is clear to me that achieving those goals through plant-based nutrition, we also achieved a corollary result. We restored the body's own powerful capacity to resist and reverse vascular disease. Plant-based nutrition, turns out, has a mighty beneficial effect on endothelial cells, those metabolic and biochemical dynamos that produce nitric oxide. And nitric oxide, as I've noted, is absolutely essential to vascular health, a finding that won the Nobel Prize for Medicine in 1998. 1, it relaxes blood vessels, selectively boosting blood flow to the organs that need it. 2, it prevents white blood cells and platelets from becoming sticky and thus starting the buildup of vascular plaque. 3, it keeps the smooth muscle cells of arteries from growing into plaques. And 4, it may even help diminish vascular plaques once they are in place. To understand how plant-based nutrition facilitates nitric oxide's production, you need to have a sense of the biochemistry at play. The essential building block for nitric oxide production is a substance called L-arginine, an amino acid that is in rich supply in variety of plant foods, essentially legumes, beans, soys, and nuts. Now, in figure 6 shows the schematic how arginine fits neatly into the enzymatic action of nitric oxide, which then produces nitric oxide from the arginine and oxygen. So I'll just quickly show you that. However, as you can see also in figure 6, there is a competitor for nitric oxide, a systematic dimethyl arginine, or ADMA, which is manufactured by our bodies in the course of normal protein metabolism. When we have too much ADMA, then L-arginine is edged out for a position in nitric oxide cythinase, and the production of nitric oxide fails. There's another delicate enzyme with a formidable name, dimethylarginine, dimethyl amino hydrolase, or DDAH, that destroys ADMA in order to favor production of nitric oxide. But the usual cardiovascular factors, high cholesterol, high triglycerides, high homocysteine, insulin resistance, hypertension, tobacco use, all impair the ability of that delicate enzyme to destroy ADMA. The biochemistry explains what is perhaps the key mechanism through which my patients become heart attack proof beyond 20 years. Their plant-based diet reduced or entirely eliminated all the above cardiovascular risk factors. The more compliant the patient, the more he or she reduced the risks. Along the way, they also reduced symptoms such as angina pectoris, chest pains, perhaps the most frightening and incapacitating symptom of heart disease. Normally, physical effort or strong emotion causes the endothelium to go into action, producing nitric oxide, dilating the blood vessels, and thus boosting the flow of blood to the heart muscles. But in a patient with coronary artery disease, the endothelium's capacity is badly diminished. His narrowed arteries do not dilate, and therefore his heart muscle does not receive the blood flow it needs. Thus result the pain. It may be mild or it may be excruciating. Many patients become cardiac cripples, terrified of exerting themselves physically or making love or expressing or experiencing strong emotions. To give such patients lasting relief, it is essential to bring more blood to the heart muscle, despite the fact that the blood must flow through partially blocked coronary arteries. But how? By restoring the endothelium's capacity to manufacture nitric oxide. The effects of a radical shift in nutrition are breathtaking, dramatic, and swift. In 1996, I used plant-based nutrition to aggressively reduce the risk factors in a patient with demonstrably poor circulation to a portion of the heart muscle. A cardiac PET scan noted that the problem just prior to my intervention. Within 10 days of her starting a plant-based diet and a low dose of cholesterol-lowering drug, the patient's cholesterol level went from 248 to 137. And after just 3 weeks of therapy, a repeat scan showed restored circulation to the area of the heart muscle, and that had been deprived. There was no doubt what had happened. A profound change in lifestyle, adopting strictly plant-based nutrition, brought about a rapid restoration of endothelial cells, capacity to manufacture nitric oxide, and that in turn restored circulation. The success led to a similar pilot study with Dr. Richard Brunkin and Ray Go of the Cleveland Clinic Department of Nuclear Radiology and Dr. Candace Marchant of the clinic's departure of pathology. Very important. The results confirm the ability of the plant-based nutrition in conjunction with cholesterol-reducing medicine to restore blood flow to the heart muscle previously deprived of adequate circulation. I emphasize that this is not a case of development of collaterals, naturally occurring bypass which takes months or years to appear. The heart disease in these patients was long-standing, and the baseline study showed no reperfusion by collaterals. The reperfusion was observed 3 to 12 weeks after the patients made the lifestyle changes we outlined. Students of physics will recognize this phenomenon as Poiseuille's law, which describes the flow of liquid through hollow tubes. Think of a fire hose replacing a garden hose. Thus, a modestly restored dilation of blood vessels provides a huge increase in blood flow, clearly visible on the scans, and causes angina to disappear within weeks of starting therapy. The endothelial system for enhancing and protecting our vascular system is brilliant. We can prevent it from breaking down, and we could restore it to good health even after hazardous lifestyle has injured it. Just in case you're not convinced, let's take a look at what happened to the patients in my original study. So that was chapter 5. The information in there is profound. It's important. And I beg you, if you have cardiovascular disease, if you have heart disease, I don't care what your cardiologists are telling you. I don't care how much you like them or love them. Please take the time just to look at Dr. Esselstyn's studies. Look at his research and look at the cardiologists that are starting to follow in his footsteps. The work he is doing is profound. It is life-changing, and it will absolutely save your life. Thank you for tuning in. Please check back on Wednesday for chapter 6. And we will be covering his chapter, Living, Breathing Proof, which is important. And then on Friday, I will be posting chapter 7, which is Why Didn't Anyone Tell Me? So again, please go out and buy his book. Thank you for tuning in, and I wish you a ton of health, happiness, and wealth. Peace.